will be looking for the teleconsultation. So the teleconsultation is very, very important. So why we are going for the teleconsultation? Because so the patients yeah, because so the patients will be looking for the consultations. Okay, so sometimes they might go for the second consultations also. So sometimes if they are visiting with the local doctors and if they want to go for the second opinion and something, if the possibilities are there to go with the expertise, okay, but the distance might be issue there. So if it is the distance is reduced through the telemedicine, so they can have the teleconsultation with the for the second opinion. It's need not to be only for the second opinion. It can be for the first consultation also can be done. Okay, so why I'm saying this teleconsultation, especially for the second opinion, so the patients is uh, uh, overthinking that why we need to go for the another doctor for the second opinion. We need to travel so much distance and all those things. So if you implement the teleconsultation easily, the patients can visit the doctor. Okay, so this is the sequence of teleconsultations. When you talk about the teleconsultation, the patient in. Okay, so the patient will be looking for the OPD visit. Okay, so they will be entering to the OPD, then they will be looking for the general physicians. So with that, so they will be looking for some kind of preliminary checkups and all those things. So all the doctors will be doing all this. Okay, so then the patient receives the treatment. Okay, so then whatever the medications from the local doctor, if there is no need for further any referred treatment or something, that means they will be going out of the entire the flow. Okay, if the patient is patient is not comfortable with this medications and other things, so the patient wants some more advice. The physician also is referring to check with the expertise. Okay, so then they will be referring to the telemedicine system. Okay, so you need to understand here, the patient is in, then they will be visiting with the local doctors and all the thing. If there is not required of any requirement of telemedicine, the patients will be getting their treatment and they will be going out. If the patient is required some expertise, advice or suggestions for the treatment and all those things, so the general physicians will be referring the patients to the telemedicine systems. Because so when in the patient is done with all uh, preliminary screening and all those things, so the diagnostics and all those things, then sometimes if it is needed, then the patient is referred to the telemedicine system. So when you are the patient is referred to the telemedicine systems, so they will be doing some special investigations, so that can be done. So after the special investigations, so the expertise will be giving the kind of suggestions, the altering the addition to the treatments and all this will be. So for that, so once the patient is referred to the telemedicine system, so they will be visiting the telemedicine unit. So we have like a telemedicine data entry console. So they will visit the entry consoles. Okay, so the each and every the console will be dedicated. Data entry operators will be there, so they will be entering all the patient records, data, whatever the results, images they got, the test results, everything will be taken. Okay, then they will be fixing the appointment with the consultant expertise with the expertise. So they will be fixing the appointment date and as well as the time. Okay, for the online telemedicine sessions. Okay, so here once all the data, that's very very important thing is you need to understand, it's not something only the patient will be visiting the data entry console. So all the information has to be uploaded also. All the information has to be entered by the operator in the telemedicine. Then it will be transferred to the all the data in the offline. Okay, so it will be it will be transferred from the this locations. Okay, so it will be reaching to the consultant. Okay, do you understand? So this is the flow we are getting. So once the all the information is given, so now like that, say example expertise, say example neuro expertise is there, neurosurgeon expertise is there in the Vellore. So in and around Vellore, there are several small the primary health centers are there. So everybody will be fixing the appointment with the surgeon. Okay, neurosurgeon. Okay, so the neurosurgeon availability time is limited between 10 o'clock to 12:30. Okay, so what will happen? The patient will be coming from the different primary health centers. Say example, primary health center 1, some patients will be there. Another primary health center, 2 patients will be. So the patients will be forming the queue here. Okay, based on the appointment. So based on the availability, the patient will be available in the queue. Then they will be looking for the consultation with the expertise. You understand what I'm trying to say? So there you'll be having the online video reference conference systems. So through that, the teleconsultations protocol can be executed between the patients and the expertise. So when the patient is connecting with the expertise, the local doctors also will be available. That's what I am trying to say. The consultation for the patients between local doctors at the nodal hospitals, they will be presenting, and the special doctors in the referral hospital. So whenever the patient is saying about their issues and all those things, so the local doctor also can consult with the expertise here. Okay, so that is the advantage of the system. So the time limiting with the short time. So the referral from the referral centers, expertise can interact with the patients as well as the local doctors, so that they can plan for the medication. So that is very, very important. They will be planning for the medications. Okay, so I hope everyone would have understood about the teleconsultation. So this can be used for the like a the second opinion and all those. So the teleconsultation is very, very important. So when you talk about the applications of telemedicine, so we can have the different information. So the ultimate aim when you want to perform the telemedicine, so you'll be exchanging the informations. So this information will be exchanged between the hospitals and the physicians. Okay, so once the information exchange is encouraged here, so all the informations will be stored in the some kind of cloud or some kind of local storage and all this. So this information can be taken for the group of hospitals. So when you are creating as a network with the group of hospitals, so they can share the information with the group of hospitals, then different research centers. So for this, when you want to network with the group of hospitals, so this hospitals should be in the same organization, or they will be signing with the MOU to share the information. So a lot of procedure has to be adapted with that. Okay, say example, one organization is opening the hospitals in the different city. What is the advantage of this one? Say some patient is in the Vellore. Okay, so if they want to visit Chennai, if the same group of hospital is there, so if they are sharing all the information with their local hospital cloud and all those things, when the patient is visiting in the Chennai hospital, they can get the same data, whatever the information is stored in that. So that is the advantage of the networking of the group of hospitals and all those things. Okay, so we'll see in the later stage later, in more detailed, elaborated way there. Then already I told you, so linking of the PHC, so the primary health centers to the central hospital. So that's what I was giving example. So when you have the Vellore as a district headquarter, so you will be having the central hospital. The central hospital will be connected with the different village primary health centers. Okay, so that is very, very important. Then we have like a video conferencing systems between the patients and the doctors. So that can be worked with the healthcare team members also. Teams, the different teams, paramedics and others to have the information exchange. So they can have for the kind of it can be used for the kind of training of the professionals and all those things. Okay, so this can be used. So we can make a kind of setting of the equipments and all those things. So that can be also. So the another important thing is we can have all the informations. So we can have the informations can be accessed anytime. So the you are creating kind of the database, the knowledge base, medical knowledge base or something. So whenever this people, authorized people, whenever they want, they can refer it also. So similarly, this can be taken for the technical papers and all those things. That is also can be done. When you perform telemedicines, we know that we come to know that we saw like how the system is working and other things. So we need to know about the benefits. Why we opting for the telemedicine? So definitely we can say that is improved access. So we can say that. So like a mobile network only. So the mobile network which is connected with the few areas, we can say few areas we have very good bandwidth and others so like that. So when you look for the telemedicine, you need to cover entire the region. So for any remote locations, that is what we are saying as a unserved are undeserved areas. Okay, so this has to be connected. So that is very, very important. So we need to have, similarly, we need to have the improved quality of care. So when you have like the different hospitals bringing into the network, group of hospitals into the network, so we can have kind of enhanced decision making with the collaborative efforts and all those things, because you'll be discussing, say example, the previous example I was saying, the local doctors, they can take the decision, but still they want to go for the kind of consultations or second opinion with the expertise. The patient want to get the expertise opinion. So they are general physicians. Sometimes they want to go with the expertise like a neuro. So in the similar way, the neuro consultant can have the expertise opinion as a from the neurosurgeon also. So that, so collaborative effort. So when you are making the collaborative effort, definitely you will be looking for the improved quality of care. So that is what we are benefits we are achieving from the telemedicine. Similarly, we have like the reduced isolation of the healthcare professionals and all those things. So we can connect with the people. That's what I was saying. Right, neuro consultant can discuss with the neurosurgeon, so they can get the peer and professional context can be improvised. So we can have the consultations, we can have the continuing education, because the neurosurgeon can have in their view, they can share the knowledge to the consultant or general physicians like that. So the improved care can be taken care. Another important thing is the reduced cost. So we are reducing the cost. Ultimately, the patient is not traveling so much of distance. So they are connecting with the teleconsultations. They are connecting with the telemedicine. So through that, so your travel necessity is reduced. So we can use resources also in the optimum way. Okay, that is a major benefits we have from the telemedicine. Okay, so when you understand the telemedicine, so we have like a different applications starting from the remote consultation and the critical care monitoring. So because the remote consultation is very, very important in nowadays in the pandemic situations, so everywhere we are saying as a social distancing and other things. So the crowd in the hospital has to be reduced. So many things. So if the health issue is very mild, then they can have the remote consultations, so that it can be taken from the distance. So medications can be given to like a through the teleconsultation and all this. Okay, so like that we can have the critical care monitoring also. So the continuous monitoring has to be there. So the disease as well as the observation has to be there. Then the program tracking. So now you need to understand that the uh, uh, the uh, the particular the disease, how much which particular area, how it's spreading, everything can be monitored here. So the observation has to be there, then the tracking has to be there. So similarly, we have like a continuing medical education as well as a public awareness. So the awareness now, in this pandemic, everywhere the awareness program was organized. So how you need to have the social distancing and also, so this kind of public awareness, then how to hygiene the hand, the wash of your hands frequently to avoid the spread of this kind of viruses and other things. So the continuing medical education as well as the public awareness is very very important. This can be used for the disaster management, disease management, home care, ambulatory monitoring also when the patient is traveling, that can be done. So then the telementored also procedures, telementored procedures for the kind of surgeries and other things. So now we few hospitals they were using the robots, assisted surgeries and others. So that's you need to understand. Then already I told you second opinion. So sometimes they'll look for the kind of interpretations with the to assess the patients and all that. So you need to understand this can work for the all the different applications. So that is what telemedicine. So you need to understand. So when you talk about the telemedicine further, we have like a drivers of telemedicine and telecare. We can say as a technological drivers. Another is a non-technological drivers. So these two parameters are very very important when you talk about the telemedicine, because the technological drivers is nothing but the lot of advancement is happening with them. Instruments, the all the equipments, so the communication infrastructure everywhere. So this all comes into the technological drivers. So when you are executing the telemedicine, you will be looking for the what kind of technology you are adopting, how you are going to computing the all the data, whatever you are collecting, what kind of the informations you are going to transfer, what kind of informations you are going to get from the this for this telemedicine. So like that we need to let for the what kind of network we have, communication infrastructures we have. So still we don't have a 5G network, so the people are working on that. So the in terms of infrastructure if you're talking, so the technology led societies and this all comes into the technological drivers. When you talk about the this technological drivers, uh, you need to understand, already I told you the technology we are going to adapt to perform the telemedicine. Okay, so when you want to perform the telemedicine, you will be looking for the advancement in the technologies and all. So that means you need to go from the catch the advanced technology to perform the telemedicine. So when you are looking for the advanced technology and all those things, so you need to look for the some few factors. So falling equipment cost, increased power on the computers. Definitely we can say that now the earlier we had like a Pentium 4 is one of the highest processor speed we have. Now we are after that core to dual core, then the I3, I5, I7 like that. We are advancement is coming in the computer. So the processor power is increasing. If it is processor as equipped with a lot of functionality and other things, then we have the analysis can be done very easily, right? So we can have the lot of works on that. Similarly, we need to build easy to use as well as we need to look about the equipments, whatever you are using, the reliability of the equipments we need to have. So nowadays it's all the improvisation is happening, so that the equipments reliability also it's increases. So network infrastructure, so we through the internet only we will be connecting with that. So we have the different technologies we have, like starting from the plain old telephone network to higher level of band broadband technology. So we'll be using the different modes. So ADSL and ATM and all this we'll be using. So technology-led society. So we need to look for the strategy. So aptitude to develop the strategy on the expansive scales. So this all comes into the technological So the another important thing is non-technological drivers. So this is very very important. So when you have all infrastructures, when you have all those things, so you need to look for the non-technological drivers also. So when you look for this, so you need to have the considered of the every individual. So extending healthcare access to the every individual. So particular region of people. So sometimes what will happen is you due to the bad weathers and all those things, so it's very difficult to provide the healthcare facilities to them, so because they have very limited access. Okay, so during the war, sometimes the hill stations and all those things, so the transport will be very less, so there is no transport conditions and all those things. So this all we need to consider, so you need to provide the healthcare facilities to them. Okay, so similarly, we need to look for the healthcare provisions for the travelers definitely. So we when we are in the traveling in sea or flight, so definitely you need to the, provide the healthcare provisions to the travelers. That is very very important. So because otherwise, if the example I'm saying, if they're traveling in ship in the sea, so if any emergency occurs and all those things, so unnecessarily they have to divert to the another port to get the medications and all. So this healthcare provisions to for the travelers are very very important. We'll see in the later stage in the detail. Okay, so the other applications we have like a military applications. Okay, so the lot of the provision has to be provided for the like healthcare provisions to the military applications and all those things. Sometimes the troops when they are in travel and all those things, sometimes they will be getting as a kind of healthcare issues, kind of disease and all. This all has to be faced. This all has to be taken care. So we need to. So other drivers, when you talk about, we can have the home telecare. So when you are going for the home telecare, so that again the cost will be reduced. So we need to have the very good market. So the product has to reach the market and all this. Similarly, we need to have the health policies and strategy. How we will be achieving that. So very important thing is, so when you want to perform the telemedicine, the reimbursement also it's a conditions you need to check with the insurance companies and all those things. Okay, so we need to think about the what is happening with them telemedicine in the developed countries and underdeveloped countries. Okay, so when you talk about the developed countries, we have like an increased age of populations. Okay, so increasing the cost of the medical technology. So in the developed countries, the patient expectation is more. Okay, so you need to understand. So when you are considering the underdeveloped countries, so we have the kind of the drawbacks and kind of basic healthcare. We are not positioned to provide for the in the rural areas and all these things. So because of the distance, already I told you, if you're going with them, say example in hill stations and all those things, so the remote location near to the forest area and all those things, they need to travel so much to come for the primary health center. So the primary health center will provide only the basic health care facilities, but still people are not getting that. Okay, so the distance. Okay, so that's a very very important factor you need to consider when you perform this telemedicine. Then it might be connected, it might be working on that. So the similarly we have like a disease and a deaths from the childbirth climbed almost 80%. So the government has to have the health policies programs. So when they have certain budgeting has to be allotted. So when you are as a underdeveloping country, so they have a lot of issues like how they'll be putting in the budget to the healthcare programs. How much is the budgeting for the healthcare programs and all. That is also, it's very important. So this all you need to consider when you talk about the developed countries and underdeveloped countries. We have huge gap. So how we are going to overcome with that? That is very important when you talk about. So anything, if you are thinking on telemedicines, you need to consider how the developed countries executing in the telemedicine, how underdeveloped countries are trying to execute, but still facing the lot of issues. How this can be overcome? So because when you want to overcome with these issues, so you need to have the affordable technology. When you're bringing with the affordable technology, you'll be reaching to the people, so you can have um, a lot of the equipments. Then the diagnosing will not be issues, the cost will be reduced, so people will be trying to connect with the consultations with the doctors and doctors. Okay, so further, if you understand the what is the scope of telemedicine, so we have the different types of telemedicines, like a teleconsultation, teleeducation, telemonitoring, and telesearch. So this is a broad areas we can see that. So when you talk about the teleconsultations, we saw like a few examples. So how the patient wants to see the doctors and all this, like that. We have teleeducation to have for the healthcare professionals and all this. Telemonitoring, nowadays a lot of monitoring devices are there. It's a home telemonitoring can be done. Then telesurgery, so the telesurgery also, it's a presence of robots. They're planning nowadays, so this can be controlled. Okay, so you need to understand when you want to have this kind